Multiple choice question of chapter 25, chronic inflammatory diseases of the nose and paranasal sinuses. Here the first one MCQ is a 25-year-old girl came with the complaints of nasal obstruction and recurrent epistaxis. On examination, both nasal cavities were full of foul-smelling crusts with wide nasal cavities. Which of the following solution will be used for installation in the nose? Option A is 25% glucose in glycerin, 25% potassium iodide in glycerin, 25% soda bicarbonate in glycerin, 25% sodium chloride in glycerin. Answer is A. 25% glucose in glycerin to remove the crust from the nose or nasal cavities. The diagnosis of this scenario is atrophic rhinitis. MCQs number 2. In which of the following demographic group primary atrophic rhinitis is most common? Atrophic rhinitis, it should be noted that atrophic rhinitis is divided into two types, primary and secondary. Primary atrophic rhinitis is most common in females around puberty. Answer is B. Secondary atrophic rhinitis occurs secondary to some diseases or surgery of the nose such as leprosy, lupus, excessive surgical removal of the inferior turbinate, and deviated nasal septum. Atrophic rhinitis is a chronic inflammation characterized by atrophy of the turbinate bones and nasal mucosa. In atrophic rhinitis, the nasal cavities are roomy and full of foul-smelling crustings. Question 3. A 22-year-old female patient who had been taking medication for atrophic rhinitis in last few years, but there was no relief in her symptoms. Which of the following surgical operation can tried for treatment in this patient? Answer is young operation. In this operation, both nostrils are closed for about 6 months, which revert the mucosal changes. MCQs 4. Which of the following part of the nasal cavity is most commonly affected by rhinitis sicca, where drying and crusting is most common? Anterior third of the nasal cavity. Answer is anterior third of the nasal cavities. The difference between rhinitis sicca and atrophic rhinitis is that in rhinitis sicca, the crusting is not foul-smelling, and it occurs in people who work in dry, hot, and dusty environment. While in atrophic rhinitis, the crust is foul-smelling. Rhinitis sicca is treated by applying of lubrication in the nose or correction of the occupational surroundings. MCQs number 5. A 28-year-old man who was recently diagnosed as a case of pulmonary tuberculosis came with complaints of nasal obstruction, a blood-stained nasal discharge. On examination, he has granulation tissue and mucosal ulceration on the nasal septum. Which of the following is the most important test for diagnosis? Answer is biopsy. Enteral washout was planned in 22-year-old male patient. What should be the direction of trocar and cannula while performing this procedure? Answer is D. Outer canthus of the eye. FESS is the abbreviation for functional endoscopic sinus surgery. Answer D. Question 8. Caldwell look operation was planned in a 30-year-old male patient. Which of the following incision will be used for this operation? Answer is sublabial horizontal incision. is given few millimeter below the gingival is given few millimeter below the gingivo-labial sulcus. The incision extends from the lateral incisor to the second molar tooth. This is the operation of opening the maxillary antrum through its anterolateral wall. After cleaning the disease from the sinus, an opening is made in the middle wall of the sinus into the inferior meatus. Question 9. Which of the following degrees of telescopes are most commonly used in functional endoscopic sinus surgery? 0, 0 degree, 0 degree, 30 degree, 45 degree and 70 degree. Answer C. In functional endoscopic sinus surgery, which of the following instrument is used for removal of the nasal polyp? Microdebrider. Option B.